workflow for guided oral hygiene. What we do with guided oral hygiene is I review their medical history, I review their behavioral history, I write any treatment modifications that I think will need to be made, because some of these patients that we see are super high risk, right? If you can't drink water, you're pretty high risk. And so we're looking at all of that kind of stuff. Then if I've seen them before and we have a dental chart, I provide the hygienist with the dental chart, as well as we have the caregiver take extra oral photos. And we use that extra oral camera, that Lesterdine extra oral camera is the one that we use. And we just have the caregiver shoot photos in the mouth using retractors. The hygienist then will take that chart, take those photos, and she will come up, this is Jing Jing, my hygienist, she's awesome. She'll come up with what tools does she think that that patient needs to have optimal success for their oral hygiene, and what is her oral hygiene plan, and she'll write that up. And then the caregiver will work with Jing Jing, or Alicia, she's also doing guided oral hygiene, she's our hygiene student. And this is what guided oral hygiene looks like. There's the caregiver who's cleaning the teeth. This is what Alicia can see, and Alicia is guiding the caregiver in proper oral hygiene while that patient is in lockdown. I also can log in, and you can see me there. Alicia's a student, so direct supervision. So there I am, sitting there watching her do that, and it's great. So then here, she can either gather data, and I can look at it later and look at those patients and see what needs they have, or I can watch it live, and I review and react. So there's a bigger picture of what guided oral hygiene looks like. There's the shot of the mouth, the shot of the patient overall, the hygienist, and the dentist. So when we find things in guided oral hygiene, so I'm watching these videos and I'm seeing caries, and I'm like, well, we should stop those caries if we can. We're looking at using silver diamine fluoride and applying that silver diamine fluoride, utilizing synchronous teledental supervision and training of caregivers. Here's our workflow for that. And so make sure it's legal in your state. I've created a training video for the caregivers. It's very basic. It doesn't have a lot of dental terminology because the caregivers are people who have not been trained in dentistry. You're welcome to have that video. It's also on your handout that's posted to the course website. And so that's our training video. It's about 7 minutes, I think, long, and the caregivers can watch that and learn the basics of SDF. Then I have the caregivers take a written exam, and they go through and they take their written exam. I grade their written exam. We do an in-person practical exam in the parking lot. It's real fun. We set up in the parking lot. The caregiver shows me what they would do with a patient. After they pass that, I can then send the silver diamine fluoride with written instructions to the care facility and join them with synchronous teledentistry. There I am. There's Becky. She was our first caregiver trained, and she's applying the silver diamine right here as I am watching her. And yay, we stopped some caries in that gentleman right there.